Madam President, I am pleased to present Kenneth A. Dickinson. Mr. Dickinson is co-founder and past president of the Board of Directors of Secundum Artem Reaching Pharmacists with Help, and also co-founder and president of the Board of the Pennsylvania Nurses Assistance Program. He is a registered pharmacist with an MS in health education who practiced hospital and retail pharmacy for 15 years before changing careers to work in the behavioral health and addictions field. He enjoys a national reputation as a noted educator, lecturer, and advocate in the area of addiction recovery and behavioral health. His message is often personal, powerful, and insightful. Mr. Dickinson has taught psychopharmacology courses and other behavioral health-related classes at the University of the Sciences and several other local universities. In addition, he lectures nationally at several summer programs on alcoholism and is certified as an addictions counselor, prevention specialist, and an employee assistance professional. Currently, Mr. Dickinson is employed as Director of Marketing for Gaudenzia Incorporated, the largest nonprofit drug and alcohol treatment provider in both Pennsylvania and Maryland.
On recommendation of the nominating committee and with the approval of the Board of Trustees, and by virtue of the authority granted this institution and invested in me by the Commonwealth of Pennsylvania, I confer on you, Kenneth Dickinson, the degree of Doctor of Science, honoris causa, with all the rights and privileges pertaining thereto. In testimony thereof, I ask that you be invested with the hood symbolic of the degree and present you with an official diploma. Please join me in congratulating Dr. Dickinson.
Wow. In the introduction, it mentioned something about presenting in an emotional manner. This will be, I guess. I'm overwhelmed. I'm Ken, and I'm an alcoholic and an addict. I'm also a graduate of PCP&S, a registered pharmacist, and the son and the nephew of 2 other graduates of PCPS. For the first 14 years of my life, I lived on the campus near PCPS. My parents took in pharmacy students as boarders, and from the age of 0 to about 14, every year we had about 14 pharmacy students living in our house. It was like growing up in a pharmacy fraternity house. My role models were pharmacy graduates and pharmacy students. My father was partners in a retail pharmacy only 6 blocks away from the school. At the age of 10, I started working in that store as a clerk and a stock boy. My whole life was immersed in the profession of pharmacy. I never once considered another profession or another school other than PCP&S. In fact, my identity, once I became a student and became a pharmacist, was totally involved in being a pharmacist and a healthcare professional. My pharmacy license was, unfortunately, the most important thing in my life. It held such a high value that I almost lost my life in order to maintain my license. Today, thanks to a process called recovery, I am much more than an alcoholic and an addict and a pharmacist. I'm a husband, a father, a grandfather, a coworker, an educator, and hopefully a friend to many. Now, my story is I didn't ingest alcohol with the intention of one day losing everything that was important in my life. Like so many others, I drank alcohol to be social and to relieve stress, and other various reasons. Not for all individuals, but for some, and many, addiction has a genetic component, and this genetic component gives certain individuals a vulnerable, susceptible brain when they ingest a psychoactive substance. I am one of those that has that type of a brain. My drinking progressed to the point of interfering with my studies and with my work. I found I could minimize that impairment by self-medication. I treated hangovers, headaches, tremors, and other adverse effects associated with the alcohol with medications that, in my mind, I was educated and I knew how to do this, and I would be in control. I utilized my knowledge regarding medications to attempt to stop the drinking, or at least to minimize and control the drinking. As a result, all I did was develop a dependency to prescription drugs, in addition to the alcohol. After graduating, my next 13 years resulted in a downward spiral, where in that spiral I encountered loss of family, loss of jobs, loss of my health, loss of my home, loss of self-respect, and very importantly, loss of the principles that had been given to me in my professional education and that came from a profession such as pharmacy and that came from the faculty. For those 13 years, I knew I had a problem and I sought professional help. And in those 13 years of seeing professionals for this problem, I never once breathed a sober breath. It wasn't until I encountered what's known as self-help or peer assistance that I found relief. In the spring of 1981, I was sitting in an emergency room in a wheelchair in cardiac arrest. I had hemorrhaged over 90% of my blood. In fact, an anesthesiologist that was on his way to lunch saw white lips and thought, I've never seen white lips except on a cadaver. What is this sitting here? He resuscitated me, transfused me, and I was told that it was a miracle and that I was fortunate to be alive. What led to that hemorrhaging led to me having extensive gastrointestinal surgery. And I was discharged from that hospital after a few days, and upon discharge, I was told that if I were to pick up, drink, or use drugs again, I wouldn't live more than 6 months. In my mind as a pharmacist, I didn't have control, and I drank and used that day of being discharged from the hospital. But in my pharmacy mind, I sat back and I saw an expiration date. And I saw 10/81 that I would be gone. The thing is that I was in an active addiction at that time, and one of the definitions of addiction is loss of choice. And I didn't have choice at that time because I wasn't yet in a program called recovery. Today, being in something called recovery, I have a choice. Fortunately, I was referred to one of these self-help groups. And I went to these meetings, and ironically, I met a gentleman who was a recovering anesthesiologist. This individual introduced me to a program of recovery. I credit that man and his wife for saving my life because they took me in. When it came to starting something like SARF and trying to do something in the profession of pharmacy, In my mind, I was just doing what I was supposed to do, reaching out and helping others that they wouldn't suffer what I had suffered. They introduced me to a program with a new way of life based upon practicing certain principles. Principles that I hope to share with you today, such as gratitude, hope, faith, perseverance, and helping others. This physician, ironically, had been introduced to recovery through his profession. Medicine had a peer assistance program. Pharmacy did not. This was 1981. In fact, at that time, if a pharmacy student or a pharmacist admitted to having a problem or were detected as having a problem, chances were that it meant expulsion from school, it meant loss of job, loss of license, and possibly even incarceration. We locked them up in 1981. Pharmacists and pharmacy students, because of that, didn't come to the profession and look for help or assistance. And add to that the nature of their disease having denial. So pharmacists and pharmacy students were not finding this thing that I had found called recovery. In my first year of recovery, in one of these meetings, I met another recovering pharmacist. And he and I lamented over the fact that other professions had programs, but pharmacy did not. And we saw pharmacy as being greatly impacted by this issue. In 1983, early 1984, this gentleman and I started a program called SARF. It's known as the Pennsylvania Program for Recovering Pharmacists and Pharmacy Students. We based SARF upon these principles of recovery that had been given to us and that were helping us to stay clean and sober. The profession of pharmacy wanted to help. People in our profession knew there was a problem but didn't know where to turn. This other pharmacist and myself, we became the where to start, how to help. Support came from a lot of places, and I want to mention that PCPS was at the forefront. Support came from PCPS faculty in our very early days of starting this program. For instance, Dr. Hassar and Dr. Downs would have me come in and speak in their classes each semester. We started to heighten the awareness within the profession that here's a problem, let's not sweep it under the rug or deny it. Let's be there because now we have a solution to this problem, a program called SARF, a program of recovery. There are many pharmacists in recovery today because of those efforts. Just this past week, I was receiving emails from people around the country that got sober 25, 30 years ago through SARF, saying that they sat in those classrooms and they heard that story, and that a few years later, they're out there practicing, they have a problem, they remembered that story in Dr. Hassar's class. They called the school, they got my number, and they found recovery. They never lost jobs, lost licenses. This program works. Since its founding, SARF has become recognized as a national model for peer assistance. And SARF has been responsible for introducing over 6,000 pharmacists and pharmacy students in the state of Pennsylvania to the process of recovery. That's 6,000 who never had to endure the results of jails, institutions, and death, which is what happens to somebody who is addicted or chemically dependent. Today, I identify myself much more than a pharmacist. I must remember that I'm an alcoholic and an addict because surviving this adversity is the most important thing in my life, and without it, I don't have life, and therefore nothing else. Without my recovery, I most assuredly would not be alive. My message to the esteemed graduates of 2013 is that I'm talking about my specific adversity and overcoming it. Well, all of you have had, will have, and some unfortunately might be currently undergoing some form of adversity in your life. And what I want to offer to you is, don't give up. My recovery introduced me to an axiom that states, for every adversity in life, there is a benefit of equal or greater proportion, but that benefit is contingent on practicing some principles, some values, and you will encounter benefits. I've seen this axiom in action in my life, in my 30-plus years of recovery, and in the lives of thousands of others. It has happened because of these principles: self-examination, persevering in tough times, trusting in others who have earned and deserved your trust, helping others, and being grateful. When I say grateful, I mean being grateful for everything that has been given to me, everything that has been taken away, and for all that I am allowed to have today. Graduates, today is a major landmark in your life, and it's a day for special gratitude. Enjoy these feelings you have today of accomplishment. You deserve this after all the hard work and the time that you put into your academics. But also make sure that you know you did not do it alone. Gratitude. Gratitude to family, friends, UScience, faculty, and staff have been a part of your success. Take time out to let these others know that you are grateful for your success. Thank them for their support and their love. And lastly, I would like to focus on the principle of altruism, because that's what SARF is about, and I think today's recognition is not about me, it's about we. It's about a program like SARF. Many think that altruism is the most rewarding behavior we as humans can practice. SARF and my presence shows how altruism can be rewarded and can be successful. It has been said, and I have this stuck up on the wall of my office, that the greatest act anyone can do is to reach out and lift up someone else. Graduates, as you move forward with your life, please remember a small act of love, such as starting a program like SARF, just 2 pharmacists wanting to help a third. That's how it started. Can become a very significant event, and it can result in saving thousands of lives, families, jobs, licenses, etc. My hope is that as you are faced with adversity, you will be able to respond and continue to find success. Thank you.
Thank you, Dr. Dickinson, for demonstrating character, for rising above adversity, and showing what achievement really is. Dr. Dickinson, we have bestowed upon you this university's highest honor, and to have you become an alumnus with the class of 2013 enriches both this class and our institution. Your name will add even greater luster to our historic list of distinguished honorees. Thank you again.